Have you ever met someone so intriguing you had to interview them twice? No? Just me? Well, that's what we have for today's conversation over coffee. Dr. Gokal is back to answer some tough yet hopeful questions about diversity, equity, and inclusion in healthcare, pulling on his experience as a faculty member here at Practicing Excellence. This is a big question in healthcare right now, so without further ado, let's jump right in. So for those at home, I had the honor of working with Dr. Gokal last fall on the release of Practicing Excellence Diversity, Equity, and Inclusion program. Now that answering the needs of underrepresented and underserved is a top priority in every hospital boardroom in the country, Dr. Gokal, how does it feel, or did it feel at the time, being one of the primary faculty members for a program as important as that?
You know, it's incredible to be able to even be talking about it here in this platform. There's so much that goes into training and educating others, but so many facets of life and practicing medicine and healthcare delivery that don't really get touched upon. And they are those foundational principles of how we connect with each other and our patients and really build successes, but feel successful in what we're doing. So it is so vastly important that we point out and call out and look at the way that we have always done things and how we do those differently, and also look at diversity and how we can be inclusive of all of the things that are constantly changing around us, because they always are. And I think that's so important in really any field, but especially so much so in healthcare, to really constantly being adaptable and innovative and be able to flow with the changing world around us. The awareness is of utmost importance. And I think, like that idea of implicit bias or hidden biases, again, it doesn't make anyone a bad person, but it's so important to acknowledge that it exists and recognize how we can modify the world around us to be better at what we do.
Yeah, I love that. Saying awareness is a big thing. I think people don't even realize that's just the first step, and that's really important.
Absolutely.
Going off of that and your background as an educator as well, how important do you think it is to educate your colleagues as well as residents on training about items of diversity, equity, and inclusion?
That type of training is so necessary for absolutely everybody. And I think that invokes a little bit of that challenging piece, is that part of that is also holding everyone accountable, myself included, right? And so as you have conversations, whether it's with a learner as an educator or with a colleague as a colleague or a friend, being courageous enough to hold each other accountable when something might not have been communicated as possibly open or realistic as it could have been. And again, that idea of knowing that nobody's doing that intentionally out of negativity, but pointing it out can be very helpful and also rewarding, because we don't know if we don't know to know that. And I know that's really redundant to say, but if we do explore and keep each other open and help others learn from our own experiences and maybe even mistakes, we can really find a really rewarding value from that on the other side of things. And at the end of that, we benefit, as do everybody else who's communicating with us, which for many times is our patients and their families. So of huge value to be aware of it.
This is more of a interesting question for me. I don't know if you can truly answer this, but have you seen an impact either from your work here at Practicing Excellence or in your work at Valley Health that your own mentorship has had on these issues?
Absolutely. I would say the biggest impact I've seen is that on myself. And when I recognize it in myself, I feel confident in being able to share many times, whether I want to or not, with others, to be able to role model, but also to let people know that it's not my job to be right or know how to do everything right all the time. Certainly I would love to, and I try to, but that's not the reality. And that's okay. I want my colleagues, my learners to know that part of this role, part of any role, is recognizing how we can build ourselves to be our best versions of ourselves, and being okay to adapt and to change and recognize when maybe things are not going their best.
So right now at Practicing Excellence, we're in a unique position where we have this coaching and micro-learning tool that combats different kinds of issues in healthcare today. Like we talked about earlier, from unconscious bias to improving the patient experience, what other issues would you like us to address in the future?
I always think about the impact that Practicing Excellence and the Experience Project had in my own career trajectory, and the idea of deep diving into what one might consider their balance in life, their satisfaction versus their expectations, and making sure that that's really aligning practically with the group in which they work or the environment in which they work and the culture of the world around them, because everybody has that very differently, whether it's working 3 days a week and being off 4 days a week, or being off 2 months in a row and working 6 months in a row. Everyone will find their own idea of what they find satisfactory, but being able to align those expectations is so important to being able to find success with those satisfactions, and knowing that one size definitely does not fit all. So definitely encourage everyone to really think heavily, introspectively about their true satisfiers and what contributes to that, and then looking differently at those detractors and how they might better align with the environment in which they're in. A lot of that has to do with perspective and values, both intrinsic and extrinsic, and I think that's something that the project brings great value to.
Well, thank you so much, Dr. Gokal. You are a rock star. Thanks for meeting with me again, and that's it. See you guys later.
It was such a pleasure.